Good afternoon, everybody. I am so pleased that you have joined us for our session today on accessing healthcare for those of us with vision loss. This will be kind of the debut of a very important report that focuses on those of us in Wisconsin, particularly older adults who live with vision loss, and how we're doing according to some really important data. So I am so grateful that you are here because we see this report as a very powerful tool in our advocacy tool belt, both now, but for years into the future. I will also share that the report, because it's about us, can have some pretty shocking data to it. A lot of it might be stuff that we intuitively understood, but when you see the numbers, it's a little bit to process. So as you're learning about the report this afternoon, I also want to just invite you to take a deep breath if you hear something that feels hard or upsetting to you, and also know what an important advocacy tool this gives us. I am over the moon pleased to partner in this big data project work with Jacci Borchardt from Vision Forward, and she and I will be sharing the information with you today and also what that means for advocacy. So Jacci, I'd love to turn it to you to introduce yourself.
Hi, thank you so much, Denise. So as Denise mentioned, my name is Jacci Borchardt, and I am the CEO at Vision Forward Association. And I'm very excited to have this opportunity to share the results of the Big Data Project. I've been part of the Aging and Vision Loss National Coalition, which actually started in a different form about 5 years ago. But we've been working as part of a steering committee for approximately the last 3 years to address some of the biggest issues as they relate to aging and vision loss across our entire country. And one of my roles is as the committee chair on the data and research committee as part of the Aging and Vision Loss National Coalition. And I have the pleasure of working in partnership with Dr. John Cruz, who's been really a lead researcher in the field for over 30 years. And one of the primary outputs of the work within that committee has been these big data reports. Wisconsin was in about the first 15 or so states to have their big data report completed. The goal is ultimately to have all 50 states, as well as Washington, D.C. and Puerto Rico, to have these reports so that they can really be armed with this important information. So look forward to sharing that information with all of you today and really thinking about the linkages between this information and advocacy efforts, really reiterating the importance of the vision rehabilitation services that both Vision Forward and the Wisconsin Council provide, and talking about some of the next steps that can be taken to really put this data into use to help all the constituents that our agencies together serve.
Awesome, Jacci. Thank you so much. I want to wish Jacci a huge congratulations. If you didn't catch her title, she is the new CEO at Vision Forward as of April 1st. So excited and happy to work with you in your new capacity, and just want to express my gratitude for all the years of close working relationship with CEO Emeritus Terry Davis. So those of you who know Jacci and Terry, please join me in wishing everyone well at Vision Forward during this really important transition. I'm so glad that Jacci, you mentioned the National Aging and Vision Loss Coalition. The council is also involved in this coalition, and it's really one of a kind, because we recognized the importance of really unifying our voices across vision loss, particularly in the older population. And so this is a combination of multiple organizations, both at the state level and national level, coming together to really raise up our voices around the issues facing older adults with vision loss. I serve on the policy and funding committee, and I co-chair the Transportation Working Group. So more to come from the National Coalition as we continue our work. And Bob, whenever you're ready, you can feel free to start the slides. Marvelous, and we can move past the title slide. So over the last number of years, we have noted that we kind of lack in data in our field when we're talking about people with vision loss, and we really need it because it strengthens our message as advocates, whether we're doing public policy advocacy or we're doing advocacy within health institutions, whether we're partnering with other aging and disability organizations. And that data, when we couple it with our lived experience and our stories and our connection to important trends, we can put together a very powerful advocacy message. And I love this quote that comes from W. Edwards Deming, which is, without data, you're just simply another person with an opinion. So we see this big data report on Wisconsin and then the national report that goes with it as really a powerful tool in our pocket. And we can move forward. We've had big picture data for a while. So we've been able, when someone asks us, well, how many people in Wisconsin live with vision loss? We've been able to give them a rough number based on the American Community Survey and some other tools. And right now we know after the census that it's about 109,000 people in Wisconsin who live with significant vision loss, ranging from blindness to legal blindness to significant difficulty seeing. That's self-reported data, so those numbers may actually be higher because sometimes folks are hesitant to report. But that along with our number of folks who experience unemployment, which is 70%, really were our two biggest data numbers. And we were really seriously disadvantaged when we'd be in the advocacy playground, because other populations could say, things like this, our group experiences this level of poverty, our group experiences these barriers, and then have numbers to back it up. We had life stories to back it up. But sadly, in our world, life stories alone are insufficient. So we need the numbers to go with the life story. And we can go forward. So information that really matters in the advocacy arena is how big is the population of people with vision impairment? How are people with vision impairment different from people without sight loss? And this kind of question gets at what's our level of poverty that we experience? How are we doing health-wise compared to our sighted peers? How are we doing mental health-wise compared to our sighted peers? What about our levels of education? All of that kind of comparative information is really critical. And then also, where are we seeing people with vision loss? We know, that there are greater numbers of people in some counties than in others. So what implications does that have for service provision? We know that people of color, particularly African American and Indigenous people, are significantly more impacted by vision loss, and women are more impacted than men. And the Big Data Project gives us those concrete numbers to be able to have this conversation. And we can move forward. And Jackie, I'm going to turn the slide deck over to you at this point.
All right, great. Thank you so much, Denise. I appreciate you really kind of setting the backdrop for the importance of this information. So based upon those questions that Denise shared, let's really think about then what would be the aim of this big data project. And what we're seeking to do is that we understand. Sorry, my watch was talking to me. We want to make sure that we provide state level data on the prevalence of blindness in individuals age 65 and older. The purpose of this project was really focusing on older adults. So all the data that we're going to be sharing today is data that's based on individuals 65 and older. As Denise talked about, we know that distributions of people are different across our state. Population density is different across our state. So we also want to find out down to the county level, what are those estimates of individuals who are blind or visually impaired who live in different counties across our state? In addition to that, we want to look at more aggregate data as we look at the entire state of people and looking at the difference between individuals who are blind or visually impaired as they relate to their sighted peers. So Denise kind of mentioned a couple of these different categories, but we really want to drill this down to data and statistics as it relates to health, as we think about different chronic conditions, as we think about measures of health-related quality of life. When we think about disability and the impact on being able to complete different tasks with independence or with limited help. We want to think about income and poverty levels, and we also want to think about education level as well. So in order to collect this data, there's a pretty big process involved. And I had the luxury of getting some of the ability to see into some of the initial processes for collecting this data. So this project was conducted by Vision Serve Alliance, which is a national organization that brings together organizations like the Wisconsin Council and Vision Forward, so blind serving agencies, most of whom have some sort of social service component to them, and brings those organizations together as part of this national group. And there's many advantages to our involvement and participation as part of Vision Serve Alliance. And some of it is the ability to be part of some of the initiatives as it relates to kind of key issues in the area of blindness and visual impairment. So Vision Serve Alliance took the lead on really hosting the Aging and Vision Loss National Coalition and working with steering committee members to identify some of the key targets, one of which was collecting more data around individuals across our country. And then Vision Serve Alliance worked in collaboration with the Ohio State University to really set up a system in order to use some existing data sets in order to get this state and county level data that was really specific. So when we think about the sources of data that were used, this was not a separate survey that was conducted. It was really around taking existing survey data and analyzing it in a way that could really pull different pieces of information together in order to get this more drilled down information, and specifically looking at the responses and the characteristics of people who are blind or visually impaired based upon their participation in these different surveys. So there's actually two primary places where this data was pulled from, and that was then used to create kind of the final outputs that we're going to share with you. So the first one is called the American Community Survey. And this is a survey that is administered by the United States Census. And what it allows us to do is to have local and national data that is really used for many different services. So this can be used to provide information about different program participation, economic pieces, even looking at emergency management services. So really this data drives lots of different policy making. And the advantage of this is that estimates can really be used down to the county level. So for us, we're really looking at the information as it relates to our population of individuals who are blind or visually impaired. And then we pull this data together with another survey that's conducted, which is called the Behavioral Risk Factor Surveillance System. And this is a different survey that's conducted by the Centers for Disease Control, or CDC. And what it does is, again, it's collecting data and it's looking at information about US residents. And it collects a lot of different health-related information. So it's looking at health-related risk factors, it's looking at chronic health conditions, and also the use of preventative services. And this data then can be drilled down to the state level. So essentially the data that we're sharing for you today is really kind of synthesis and analysis of these two different existing surveys. Now, as you can probably guess, doing the work to pull this information together and generate a report is something that is an investment. And it was something that we were able to bring together a group of 4 organizations within the state of Wisconsin who really saw the value in this information. So Vision Forward Association, the Wisconsin Council, as well as Industries for the Blind and Visually Impaired, or IBVI, and Beyond Vision all contributed so that we would have the funds necessary in order to have this state-specific report created for us. All right, so now let's dive into what actually did we find out? What is some of the data that was available? So there is a lot of data. The actual report is about, 20 to 30 pages long. So I'm just going to highlight some of the key pieces, but please know that there is much more extensive data that is available through the report. So I'm just going to highlight some things that really jump out as we look at the results from our Wisconsin report. So one of the first things that was one of our questions that we posed is really how many individuals are experiencing visual impairment. And so based upon the survey results, it's estimated that just over 4%, so about 4.2% of adults age 65 years older living in Wisconsin report that they have blindness or difficulty seeing, even with wearing glasses or contacts. So again, Denise said that this is information that is based upon self-report. And that's true of the data sets for this information. So again, this 4.2% may be an underestimation of the exact number of individuals, but it's based upon people who are responding yes to this question around blindness or significant difficulty seeing. In addition to that, we look at kind of where this incidence varies as we look at different demographic populations. So we do have kind of real statistical information that looks at the difference between the incidence in both men and women, and it is confirmed in the study that that incidence is higher in women. In addition to the fact that there are some very large differences as we look at people from different racial and ethnic backgrounds. So although the statewide average is 4.2%, when we look at people who are white, it's actually only 3.6% of individuals that are white. So what that means then is that other populations must have a significantly higher incidence, and that is absolutely true. More than 3 times as many, so 12.1% of people who are Black or African American have visual impairment. So that is a huge disparity between the percentages within those 2 different populations. And I find that particularly interesting because of the fact that we know that typically people who are white, and particularly people of like Scandinavian descent, are more likely to have age-related macular degeneration. So it's very interesting that we're seeing over 3 times as many people who are Black who have visual impairment. So, certainly they could have macular degeneration, but to me, it speaks to the fact that there likely is a very high prevalence of other diseases, things like glaucoma and diabetic retinopathy, that are causing that visual impairment. More demographic characteristics. This is a pretty high statistic, but about 40% of individuals who are blind or visually impaired have not graduated from high school. And about 30% of those individuals have incomes that are below $20,000. And this is in comparison to the Wisconsin poverty level, which is about $12,760. So for a single individual. So it does speak to the fact that we know that many of the individuals who are blind or are visually impaired are living in poverty. And I think when we think about how this links into some of our public policy efforts, I think it certainly does speak to the availability of financial resources to get assistance for individuals who are blind or visually impaired. So Denise will talk more about connecting this to public policy, but I think that's something to really kind of take note of when we look at this statistic. All right, so looking at the geographic distribution, and again, when you get access to the full report, there is a visual representation that actually shows shading across the different counties. I believe there are 72 counties, I think, in Wisconsin. But there's also an accessible graphical delineation that lists each of those individual counties and the prevalence rate within those counties. So just a couple of things that are of note, and based upon what I've shared so far, this may not be terribly surprising, but Milwaukee County is definitely one of our higher prevalence counties. And we think about the demographic makeup of Milwaukee County, knowing that there's many individuals who are Black or African American within Milwaukee County. I think we can probably guess that that is definitely, part of the source of why that prevalence is higher within our county. Contrasting that with like surrounding counties, so in southeastern Wisconsin, counties like Waukesha, Ozaukee, and Washington counties, which are kind of the suburban counties, those actually are some of our lowest prevalence rates of visual impairment. And again, when we think about the demographic makeup within those counties, that likely is not super surprising. Other areas where we see much higher rates of visual impairment are across some of our northern counties, particularly those northern counties that have higher density of people, of indigenous people. That's certainly a place where we see some of the higher prevalence rates. Unfortunately, because of just the way statistics need to be completed and having enough data in order to be statistically significant, we don't have specific breakdowns by individuals who are indigenous peoples. But when you look at the counties where those rates are higher, you can definitely kind of connect those dots in terms of the fact that those are places where we are seeing more people who are blind or visually impaired. And also a number of rural counties, there are definitely a higher prevalence within those rural counties. And again, what I think is very interesting about that, when we think about the two major organizations within the state of Wisconsin that provide vision rehabilitation services, Wisconsin Council and Vision Forward, we're both located in the two largest cities in our state. However, when we look to the north and into some of those very rural counties where there are limited resources available, there is actually a greater need in some of those counties. So when we talk about chronic conditions, this means in addition to having visual impairment, what are the connections between people who have visual impairment and other medical conditions? Now, it's important to recognize that this is not saying causation. It's not saying that visual impairment is causing these other conditions, nor is it saying that those other conditions are necessarily causing visual impairment. But however, it's looking at the fact that they're correlated. So people who have visual impairment may have these other chronic conditions. So when we compare people with visual impairment with those who are not visually impaired, there is a higher rate of stroke, arthritis, diabetes, kidney disease, depression, and hearing impairment when we look at people who are blind or visually impaired versus those who are not. And I think one of the really striking statistics is that almost 50%, so 49.2% of individuals who report visual impairment are also reporting hearing impairment. So that really does speak to that kind of dual sensory loss that can be more prevalent in older adults, and some of the challenges when we think about some of the techniques that can be used to compensate for visual impairment. Many of those are auditory. And if we're talking about high levels of hearing impairment within this population, that can make that more challenging as well. So quality of life is incredibly important and something that I think there has been more and more emphasis placed on the fact that older adults do deserve to have a high quality of life and that really should be a priority. So what do things look like for our population of people who are blind or visually impaired as it relates to their quality of life, particularly as it relates to some of those health conditions that we've just talked about? So there's a couple statistics here that I think really speak to some of the challenges to quality of life for people who are living with visual impairment. So an individual who's blind or visually impaired is more than twice as likely to report poor or fair health. They're almost 3 times as likely to report physical distress. And that's not really specified exactly what type of physical distress that is, but it does link into their ability to do some different activities that we'll talk about a little bit later. And they're about 2 times as likely to report frequent mental distress and frequent limitations to their activity. So again, this can kind of link into some of the things that we hear about isolation, depression, and certainly the statistics back that up, that is a very real challenge for older adults with visual impairments. All right, so when we talk about disability, this really relates to how is an underlying impairment, like visual impairment, really impacting a person's ability to do the things that are part of kind of their everyday functioning. So these are just some of the different things that are looked at, and these are part of those surveys where people are asked questions about challenges or limitations in conducting different sorts of daily activities. So one of the first things that's looked at is there any limitation on an individual's ability to do tasks with things that are related to cognition or looking at concentration or the ability to remember information? And only about 4.5% of people without visual impairment report difficulty in that area. And that's compared with almost 24%. So 23.7% of individuals with visual impairment report difficulty. We talk about tasks like walking and climbing stairs. Obviously, these are things that are really important in terms of community mobility, being able to get around the home and other places. And for people who do not have visual impairment, just over 20% of individuals 65 and older report challenges, and that's compared with 65.7% of individuals with visual impairment. A couple more, when we think about, again, what we call kind of daily living tasks and things that are certainly very much related to independence. Another one has to do with dressing and bathing tasks. So fewer than 4% of people 65 and older without visual impairment report difficulty in that area. And that's compared with over 30% of people with visual impairment. And then the next area, which this one probably is not surprising, given some of the transportation challenges that people who have visual impairment experience. So for a task like running errands, under 5% of people without visual impairment report challenges, compared with almost 43% of individuals who are blind or visually impaired. All right, so when we look at what are called social determinants of health, these are things that can kind of be predictors of a person's long-term health. And many times this does have linkages to a person's racial and ethnic background, their educational history, even in some cases where they live. And this is something that is really kind of an important buzzword right now in the area of health, is looking at health equity. So recognizing that not all individuals have the same likelihood of having positive health outcomes, and then what role should be occurring within health systems to help to address some of those inequities. And I think one of the things that this data really highlights is that there are some pretty significant health equity disparities among our population of people with visual impairment as they relate to those individuals who are not experiencing visual impairment. And then even within the population of people with visual impairment, there are differences. So older adults with visual impairments are more likely to have poorer health. They're more likely to have decreased quality of life, and they are more likely to have increased disability. In addition to that, we know that they're more likely to have lower incomes and less education. And those two things can create many barriers to care. So if a person has fewer economic resources, the ability to be able to pay for transportation services, to be able to get additional help within the home can be limited. Their ability to have an understanding of their vision condition can be impacted by the level of education that they have. And all those things can then create barriers to them getting access to care. And when we're talking about care, that can mean many different things. That can be talking about access to services that are available through the state to provide support and resources. It can be access to care in terms of getting connected with vision rehabilitation services that are available at our agencies, Wisconsin Council and Vision Forward. It can be also create access to care from vision health professionals, so optometrists and ophthalmologists, because in many cases, there may be diseases in which there are at least some treatments that can either slow the progression of the disease, or in some cases can even help to improve visual conditions. So if people don't have those economic resources or don't have the information or the education to really understand that, that can make some of these concerns and issues even worse and creates even greater disparities amongst individuals with and without visual impairment and amongst the group of people impacted by visual impairment as well. All right, so when we think about what the value is of the big data report and the contributions that it can make to the efforts that Denise is going to speak about shortly, one of the really important things is that it is providing us with state-specific data, and it's using the behavioral risk factors surveillance system and the American Community Survey to really provide us information at the state level. And that is something where oftentimes that information is very limited. As Denise mentioned before, we do have sometimes some general information at the state level, but oftentimes we're relying on national statistics, and that doesn't necessarily tell the story in individual states. It's the only study that's really examining health, chronic conditions, health-related quality of life, and disability measures among older people who are blind or visually impaired, and being able to compare that against their peers who are not blind or visually impaired. And it's doing this at the state level. In addition to that, we're actually drilling down into county level estimates of how many people within the different counties across the state of Wisconsin are impacted with vision loss. And the great thing about this data is that this is recent data. We're not talking about data from 10 or 15 years ago. These surveys are conducted on a regular basis, and the data utilized for this report is from 2019. So this really does give us a pretty good sense of where things are at in our recent past, and can be a relatively good predictor of at least the near future. And the really cool thing about this is that then we're taking all of this information and really pulling it together into one single cohesive document. Now, albeit a long document, and Denise will talk a little bit about how that's been adapted to maybe make it a little bit more user-friendly, but all that data is pulled together into one single document, which I think is much easier than trying to reference 15 different studies, but rather having a single place in which all that information is pulled together. So I'm really excited about the report. I think there are some awesome contributions and some really great ways that it can be used. And I'm going to turn it over to Denise to talk a little bit about some of the next steps now that we have this data and have a sense of some of the information that is available to us.
All right, Jacci, thank you so much. That was awesome and important. So a report is only as good as you make use of it. So we are already in conversation between our two organizations about how we really utilize the important information that's here. And we have already created a one-page document on the big data project that has some really critical takeaways, some of the numbers that Jacci just shared with you. That is available on the council's website on our advocacy page. My recommendation is for you to read it. And consider printing it if you have access to a printer, to share with your healthcare providers. I'm going to talk about this a little bit more in a couple minutes, but that information is really a synthesizing of the most salient points from the big data project. We have begun conversations about doing outreach in a number of different areas. We will pull together the other blind and visually impaired serving organizations in the state. So Vision, Beyond Vision, IBVI, the Statutory Council on Blindness, OBVI, to have a conversation together about what does this mean for our entities, and how do we work together on doing outreach. I've already been planting seeds with my colleagues in the aging community and the communities with other disabilities, because blindness and vision loss is often a co-disability with other disabilities, hearing impairment, as you heard Jacci mention, but also developmental disabilities, autism, and other disabilities. And so really critical that our aging partners and our disability partners have a growing awareness of the impact of vision loss. When you do a search in the state aging plan, which is a document that's created by the Department of Health Services that helps give guidance to organizations like the Aging Network and the Aging and Disability Resource Centers, as well as others, vision loss and vision impairment is not included in that document. And because vision loss is such a significant occurrence for older adults, its omission is very concerning. And so that will likely be one of our efforts as well, is better inclusion of our issues across these different networks. We really want to continue to look at health equity. And right now there's some important trends that are happening both on the local, state, and national level that we want to tap into because there's interest and energy. So I serve as a board member with the Vision Serve Alliance board. And at our most recent meeting, we gave thumbs up to the policy team with Vision Serve Alliance to really take advantage of the current federal administration's interest in social determinants of health and work on seeing if we can have vision services covered under Medicare. That has been a fight that we've been engaged in for decades, and we have highly qualified professionals providing vision rehabilitation services, but those services are not covered by insurance, Medicare, or Medicaid, and that lack of compensation is often a barrier for people seeking service. So on the national level, we'll take advantage of the current administration's interest in social determinants of health. We also know that we are involved in a critical caregiver crisis, where there are not enough caregivers for folks to have in-home support, or even to appropriately and adequately cover our long-term care facilities like assisted living and nursing home care. And so pushing more people into those facilities is a crime. And yet, if folks don't have the appropriate vision rehabilitation skills to be able to live safely and independently, that's often where our older adults end up. So as we're having conversations with policymakers, as you're having conversations with policymakers, talking about the importance of vision rehabilitation services as a way to reduce the burden on the caregiver shortage is a really powerful argument. Let's see. We also are going to be looking at future studies. So Vision Serve Alliance is planning the next level of studies once the state reports are done for older adults, looking at working age adults, the employment barriers and health concerns there. Some of what we know for the older adults, we can extrapolate potentially down, but we'd like to have the data that supports it. So that will be the next round of reports, and we'll be looking for funding for Wisconsin reports. We've got access to that. Let's see, I think that will do it on this slide, so we can move forward. Here's where your advocacy matters. So first of all, I always want to encourage us to be our own best advocates in our own self-care. You know, the public policy arena is so incredibly critical, and it's what gets me up in the morning to help influence our public policy, but also how we navigate the systems that we have to deal with on a day-to-day basis. Armed with this information can make a significant difference in the quality of our life. So we want to really build our own blindness skills. We know now that there's a big gap between the number of folks who identify as having vision loss and the number of folks who are actually building their blindness skills. About 3% of people are building their blindness skills through vision rehabilitation, access technology, orientation and mobility, low vision, magnification, you know, those tools. So even as someone who has been visually impaired my entire life, I'm constantly fine tuning and building my blindness skills, especially as I age and my body changes. So it is one of the biggest gifts you can give yourself is to stay on top of those blindness skills. And if you know of and spend time with other folks with vision impairment who have not reached out for these services, please be an ambassador for the importance of them. Also, as we see more people reaching out for those services, then that gives us the data we need to advocate for increased funding for these services in the state of Wisconsin. If people are not seeking the services, then it's very easy for our public officials to say, people don't want the services, therefore we don't see a need to pay for them. So please reach out. These skills also really help us reduce our risk of falls and medication errors. Wisconsin has among the highest number of falls of older adults that lead to significant injury and or death. And so having really good rehabilitation skills or blindness skills puts us in a much better place to not be in those statistics. And let's see, the blindness skills also really help us maintain our hobbies and our social connections, which is so incredibly important for reducing social isolation and loneliness and mental health issues. And we can move forward. On the with care providers, I frequently am educating my primary care provider, my eye doctor, other people in my physical therapist on the intersection between my health conditions and vision loss. So I have very severe chronic neck and back pain from always trying to get close to see something. And so when my PT says to me, well, Denise, you need to have better ergonomics, and when you're at your computer, I talk with them about the correlation between vision loss, being able to see and hear the screen and the screen reader, and posture. And it helps expand their ability to work with me to find best care. So again, you'll get these slides, just like we talked with you about getting the slides from yesterday's presentation. And on there is a link to an article we published here at the council on the Big Data Project that is an easy print and share with your healthcare providers. And we can go forward. Now, in the public policy arena, you know, right, as we talked about yesterday, we are in the state budget period. So this is where a budget asked from the council for $135,000, $135,500 to be precise, for additional staffing for the Office for the Blind and Visually Impaired. If the state awards this funding, then this is a great opportunity for the council to step in after that funding is secured to make the case based on the big data numbers to say this person needs to be located in the northern part of the state because the need is so significant there, particularly in Forest and Menominee counties, which really jumped out at me when I looked at the map, and that's where our biggest populations of Indigenous folks live. So that is definitely a budget ask, that $135,500 for OBVI. We talked yesterday about the importance of Medicaid expansion to cover more folks under Medicaid so that they can get the proper preventative and routine care, which includes being able to go to the eye doctor. Armed with this information, one of the things that we'll be doing as a next step is meeting with the Medicaid director at the Department of Health Services to bring this information forward and to once again try to have a conversation about why vision rehabilitation and blindness skills services ought to be covered by Medicare or Medicaid, excuse me. So stay tuned on those, but your budget asks are around OBVI and Medicaid expansion, and we can go forward. On the legislative side, I want to bring your awareness to this, and you'll see this come up in a advocacy alert if you are subscribed to our advocacy e-news. But there is a piece of legislation currently in the state assembly. It's Assembly Bill 148. There's a companion Senate bill, but no action's been taken on that one yet. But Assembly Bill 148 would call for all Badger Care Plus subscribers, so anyone on Medicaid here in Wisconsin, to have to reapply for your Badger Care Plus every 6 months, which is an incredible barrier to access to health care, and is particularly burdensome to those of us with vision loss to be able to complete forms in a timely manner, particularly if they're not in an accessible platform. That bill was introduced on a Friday. It had a public hearing by the next Wednesday, and it will be on the assembly floor on Tuesday. So it's very much fast tracked. So if this is an issue of concern for you, we would ask you to reach out to your state representative and share why this is concerning to you, particularly if you have personal experience with Badger Care and these forms, and to request that this bill not proceed going forward. And we can change slides. So I'm going to stop here, recognizing that we have about 10 more minutes together. Our contact information, both for the council and for Vision Forward, is listed on that slide, and you'll get the slides in the deck, so you'll have that contact info, so that, you know, if you want to reach out for vision rehabilitation, blindness skills training with either organization, you can do that as well. So let me pause here. I'm going to turn the mic over to Jackson, who's been monitoring the chat for us and who will also facilitate any questions that folks might have.
Hello, everyone. So I haven't seen any questions come into the chat, but if you would like to unmic and or turn on your video camera, you can please do so, and I'll call on you if you want to ask some questions.
It's a lot of information to digest, and I know some of you may be doing that now. While other questions might be surfacing for you, I'll do a couple of plugs for how to stay tuned to what's happening with the Big Data Project, ways that you can advocate, and also what's happening in the legislature around healthcare and access. So if you are not already subscribed to the council's advocacy e-news, please feel free to send an email to info@wcblind.org, or complete the form on our website. And I just heard a screen reader, so I'm guessing somebody unmuted. So I want to make sure that. Great, Rhonda, yay.
Hello, the fast tracking of Assembly Bill 148 is incredibly worrisome. Is there another option besides contacting one's legislature? Is there a nuclear option? They're doing a nuclear option on that bill, obviously. Is there an equivalent that we can do, you know, to besides counting our legislators and letting them know, you know, if we have legislators in the minority party, we're not going to be able to do much to stop the progress of this.
Yeah, Rhonda, I really appreciate that. So first of all, the other disability and aging groups are on this one as well. And a lot of the poverty groups are. It snuck up on us fast. The public hearing was held the same day as the joint finance budget hearing in Wisconsin Dells. So some of us felt like we needed to clone each other ourselves. So yeah, I don't know if there's a press event planned by my partners in the disability community. We're so busy trying to get our transportation asks together for the Joint Finance Committee. So this is unfortunate and maybe intentional timing. So definitely and there are folks on this call who have members of the assembly who are in the majority party. So if your state representative is Republican, particularly, having this issue come forward to them is really important because it's a powerful education opportunity. Even if your legislator is in the minority party, again, this is a great educational piece. We don't know what will happen in the Senate. And then of course, there's the governor's veto pen, which he may, use in this bill, but we don't really like to have things rely on the governor's veto. So yes, if you are a member of an aging group, a low vision support group, other disability groups in your community, please flag this for them and ask that they take action as well. This Rhonda, I know as the vice chair of the Governor's Council on People with Disabilities, if GCPD could also activate their constituency, that would be really excellent.
I would just
We also have Aaron and Michael from Bloomfeld Group.
yeah, Michael,
Yeah, Aaron, go for it.
or I would just say there was similar legislation last session that was vetoed by the governor. So in addition to contacting your state representative and state senator, you can also contact the governor's office to let them know how this legislation would impact you and ask that he veto it if it makes it to his desk. And Michael, I don't know if you had other thoughts to add.
Yeah, thanks for bringing it up and for your comments, Rhonda. It's really important we always talk about telling your story. I think in this situation where the legislation is so unworkable, so burdensome, I would, if you could let your assembly person, right now it's in the assembly, just tell them what it would do, to you or people and I think minority or majority, because I think everybody's looking for those stories. As Denise said, we are involved with a lot of these other coalitions. I did attend the hearing, which was very sparse, and because there was 3 other hearings going on at the same time, including a joint finance hearing on the budget. So that was very disappointing. We're in good company. There was several groups that did register in opposition. So again, I think it will probably be vetoed, but as you all know, the margins are a lot narrower. The Senate does have a supermajority, so they can override any veto. They need the assembly, but they're only a couple votes short. So as Denise said, we can't always count on the governor. So I think just let your people know. In terms of other events, we are discussing the larger coalition, maybe a very large sign-on letter after the committee takes action, probably this week, for the full assembly. There's been discussions of a press event that's still kind of a work in progress because there's so much else going on. But I guess I just make a pitch, let your legislators know, especially in the assembly, that this is not a good idea, what it means for real people.
I think that added piece about what it means for those of us who use screen readers and other access technology is really, really critical to bring forward. And, as many of you know, the council's been working with state agencies to increase accessibility of their websites, but it adds an extra layer of burden to have to navigate this with a screen reader and potential access barriers. So please include that in your testimony. Jackson, I heard another question come in.
Yes, somebody mentioned finding information about the big data project and where they can find and read that for themselves, so that way they can make sure they have the correct data.
Yeah, so we will supply that. I'm going to put together, I know we're going to send you the PowerPoint and the recordings, but that'll take some time to get together. So I'm putting together a links list, which we can get out much sooner. And I will put the link in there to the Vision Serve Alliance, Aging and Vision Loss National Coalition page, where you can download the full 30-some page, 20-some page report on the big data project for Wisconsin. There are two versions of it. One is an accessible version, screen reader access. The other one has charts and graphs and isn't as screen reader friendly.
Is there any other questions? You can feel free to turn on your camera, or feel free to turn on your mic, or you can send it in the chat.
Jackie, I'm going to volunteer us for something, so I'm going to seek your forgiveness since you don't know exactly what I'm going to say, but I would love the opportunity to share the big data project information in other groups. So we will be doing our outreach with organizations like the Greater Wisconsin Agency on Aging Resources and the State Aging Network, and the other blindness organizations that I mentioned. But if there are other groups in your area, why don't you let us know if there's an interest and appetite in having the information about the big data project, and maybe one or both of us would be able to do a short presentation, because I think this information is so critical for folks to have, so that we reduce our invisibility as an important population whose needs are not adequately being met. And I heard a screen reader again, so go for it.
Well, this is Rhonda again, and the aging groups and the ADRCs are having their legislative day on May 9th, and I will assuredly be there. So the opportunity to get this information in hands of people who can tell stories to legislators is right on target.
Awesome, Rhonda. Thank you so much for that. All right, we are just about at 1 o'clock, so let me do one last call to see if there are any other questions. Jackson, thank you so much for fielding the chat and the questions. Thank you again to all of you for attending, Michael and Aaron for your contributions as well. Much gratitude to staff who are very busy making the show stay on the road. And Jacci, many warm thank yous to you for co-presenting with me today. And I wanted to give you an opportunity if you wanted to say anything in closing, Jacci, to feel
Sure,
free.
absolutely.
Sorry.
Yes, that's all right. Well, thank you, Denise. Really excited to have this as a collaborative effort between our two organizations. Denise and I have had some nice conversation about this and recognize that, our voices together as organizations and combined with all of you can really help to hopefully move the needle on this. So look forward to continuing to collaborate with the Wisconsin Council and other stakeholders across our state to really uplift this information and make sure that it really is taken to heart and connected to the impact that it has on our older adults with visual impairments across our state. So thank you to Wisconsin Council for taking the lead on putting this together and incorporating it into your advocacy efforts, and myself and all of us at Vision Forward look forward to continuing to support that and working together.
Thank you. Join us tomorrow, everybody, at noon. I am really looking forward to talking with you about transportation advocacy. I'll be joined by two of my non-driver advisory committee members, Holly Keenan, who is a mobility manager here in the state, and Nick Musson, who leads transportation efforts with the Greater Wisconsin Agency on Aging Resources. And we'll be talking with you about the transportation programs in the state that serve people with disabilities and older adults, and how we can advocate for them. So be here at lunchtime tomorrow for our final session, and have a great afternoon, everybody.